We have Anna Roth, who is the Health Director for Contra Costa County Health Services, and Dr. Ori Civelli. Dr. Civelli is a Deputy Health Officer and also the Operations Chief for our COVID response. So they have a few opening comments that they will make, and then we will spend the majority of our time today responding to your questions and sharing with you as much information as we have available to us. So we're going to start with Health Director Roth.
Thank you so much, Kim, and thank you for everyone for joining us today for this important update related to COVID-19. And I think I wanted to start by saying COVID-19 continues to have a terrible impact on our community, and we continue to be responding on a variety of fronts to the COVID-19 threat within our community. But I also wanted to really focus our update today on some hopeful news, and that is that safe, effective vaccines are here and coming soon for most Contra Costa County residents. So we've had these vaccines now available, and we have two different products right now. We have the Pfizer vaccine as well as the Moderna vaccine, and we've had them in our county now for about 3 weeks since they've become available. Those first doses have been going to frontline health workers and medically fragile people, such as people who are in nursing homes or skilled nursing facilities. Now, because of the progress that we've made in Contra Costa County, we now have about 300 more thousand county residents, including essential workers and older adults, that will be having access to COVID-19 vaccine in the coming weeks. We see the vaccine, this vaccine effort as the highest priority for Contra Costa County, and there is nothing that we're focused more on right now than vaccinating our residents from COVID-19 quickly, safely, and efficiently. We feel the public's urgency, and we share that urgency. We appreciate the patience that we've seen during the early stages of the county vaccine rollout. I just wanted to give you an update that we've now delivered more than 30,000 doses of vaccine in the past 3 weeks. And every dose that has been sent to our county so far will be gone within 2 weeks' time. And fortunately, more vaccines are arriving every week, and we're redirecting every available resource we have to meet our immunization goals. The vaccines that are approved for use in the United States are safe and effective, and they are the key now really to keeping Contra Costa safe, as well as reopening our community. We know that's what everyone wants. And we're urging everyone to, when you're offered, when you have the opportunity, please get vaccinated when you're eligible. The more people we can vaccinate in our community, the safer all of us are. This will also really enhance our ability to reopen businesses, schools, places of worship, and every other part of our community. This really will depend on a vaccine. We know we can bring COVID-19 under control if we get about 80% of everyone who can get vaccinated. And so you'll recall that anyone who's 16 and over will at some point be eligible, with few exceptions. And so eventually what that really comes down to is really about, we want to get to at least about 725,000 county residents. That said, this is really important to remember. This is the largest public health immunization campaign in history, and it's going to take time. It's also going to take all of us. So we have about 900,000 residents who will be eligible. As I said, we're planning to vaccinate at least 80% in the first 6 months. And we believe that's really how you get to community resistance or herd immunity that you hear people talking about. This will stop the virus from spreading quickly in our community and help us all move forward and get back to the things that are so important to us. But to vaccinate that many people, we really need to start averaging 7,000 shots per day, several times more than we're now providing. When we first started, we started at hundreds of shots per day. We're at about 3,000. And this week, we plan to sort of double until we get to our goal. So we continue to ramp this up. We continue to draw on regional partners And we also know that there's a lot of information changing, and the vaccine landscape and availability will be changing as well. So we know that there will be more products come on the market probably in the coming weeks and months. We know that the administration, we've heard as recent as last week, that vaccines will be moving at maybe higher rates. But then there's also things we don't know. So we're really building to have a lot of flexibility and really to be able to accommodate more doses coming into our community. We're really building to be able to respond very quickly in partnership with the network of providers in our region. And with that, I really want to turn to our Deputy Health Officer, Dr. Ori Savelli. Dr. Savelli is actually overseeing, he's the operations chief of our COVID response, and also overseeing this massive vaccine effort. And so with that, I'll turn over to Dr. Savelli and happy to talk with you in a little bit.
Thank you, Director Roth. This is a very difficult time, but also an exciting time because we can see the vaccine coming down the pike. And we do expect essential workers and people who are over 75 years old to become eligible for COVID-19 vaccine this month. So far, those eligible for the vaccine have been healthcare workers and who are at high risk of exposure, and people who live or work in care facilities with residents who are at high risk of serious illness from the infection. But in the next 2 weeks, we will finish vaccinating the first groups of people eligible for vaccine and begin vaccinating the next group who are eligible, which includes about 300,000 county residents. We're looking at people who are over 75 years old and essential workers such as teachers, childcare workers, police, and grocery workers. As more residents become eligible for immunization, healthcare providers in Contra Costa will let their members and patients know how to make vaccination appointments. And we think our county can meet its immunization goals if every hospital and healthcare worker in the community pitches in. We're grateful for our great partnership so far. We've had partnerships with John Muir, La Clinica, Lifelong, CVS, and Walgreens have pitched in, and more are signing up each day. As larger groups of residents become eligible for the vaccine, we're counting on those providers to immunize their patients and members. And we're coordinating closely with hospitals and independent providers, pharmacies, and clinics to ensure the vaccine is available for everyone. Most Contra Costa residents will be immunized by their own healthcare providers, not at a clinic set up by the county. We understand that many people are anxious because they're not sure when they can get the vaccine or even how they will know. If you have a healthcare provider, they are part of the plan. Ask how they will notify patients and how you can stay informed. When COVID-19 vaccine is widely available, the distribution will be like flu vaccines. Hospitals, clinics, and pharmacies will offer it. And Rite Aid and Safeway have just agreed to begin providing vaccine at many of their pharmacies in our county. Contra Costa Health Services is the hub for distributing COVID-19 vaccine and for coordinating the county's immunization campaign. So the health department receives COVID-19 vaccine from the state and distributes it for use by healthcare providers in the community. Some large healthcare providers that have facilities in multiple counties get their vaccine directly from the state of California. The county also plays an important role in ensuring that federal and state guidelines are followed about who's eligible for the vaccine. Contra Costa Health Services also has clinics to provide vaccine directly to some county residents, including Contra Costa Health Plan members, Medi-Cal recipients, and people without health insurance. Information and updates about COVID-19 vaccine, but not appointments, are available at 1-844-729-8410, or check out our website, cchealth.org/coronavirus. That website is updated constantly as more people become eligible. We are waiting for vaccine to become widely available. And while we're waiting, it's important that we remember to do all we can to protect ourselves and the families. Today, about 90% of all intensive care unit beds at Bay Area hospitals are full, and the situation's even worse in other parts of the state. So to keep our hospitals running, we all have to do our part to follow the stay-at-home order, which is still in effect for our county. We also ask all Contra Costans to remain diligent about distancing, avoiding gatherings, wearing a mask when we go out. It saves lives, and together we can do it. I just want to mention, we are still in a surge. We're probably in some of the most difficult weeks of this pandemic. The ICU capacity in Contra Costa, we have about 10% of beds still open, and Bay Area wide, it's about 8.5%. The state makes adjustment based on the number of COVID patients in the ICU when they do those calculations. So our ICUs are busy but stable. We're watching for the final peak of Christmas and New Year's surge coming this week and next. So we expect the numbers to reach a peak sometime towards the end of this month. With that, I'll hand it back over to Kim for the Q&A.
Great, thank you both. So if you've just joined us, I'll just remind you that if you have a question you'd like to ask, you're welcome to drop that into the Q&A section of Zoom. Or if you prefer to ask your question in person, please feel free to raise your hand and we will unmute you. So we do have two questions that came in before we started. So perhaps Dr. Zavelli, you want to address this first one. Some of those currently eligible for vaccines say they received an email from the county alerting them that it's their turn. Others, like a local dentist, didn't. It seems communication is a little haphazard. How will people know when it's their turn and what should they do?
That's a great question. We are opening up appointments every day. So we know that many of you have filled out the vaccine interest forms, and some of you have gotten a link to a ticket to sign up, and others are still waiting. We just sent out another 1,000 tickets this morning. So if you're still waiting, rest assured your ticket is coming. Some people also filled out some incomplete information. So we are setting up a call center to call those people to get the complete information so we can send you a ticket to schedule. And we are also working on a call center that should be up sometime in the next week to allow people to call in for vaccinations as well.
So I'll just add that it's really important that that people really watch our website, you know, and that's where the latest information about who's eligible and who we're vaccinating will become available. So really, if you're uncertain, fill out the form and we will do what we can to get you scheduled. So the website is really the best place for information. So the next question, also perhaps for you, Dr. Zavelli, how will seniors not living in congregate facilities, for instance, an 80-year-old living home alone, know when it's their turn? Many do not use email, text, social media. What's being done to reach them?
That's a great question. We are, so keep an eye on our website. I know the question is about people who don't use social media. We're going to try to spread the word in the community when that turn comes, which we expect will be in a couple of weeks. So through all of our social media, we're hoping to get the word out on the TV and the radio as well. And we also hope that your own healthcare provider will help get the word out once they're vaccinating. So if you're a Kaiser member, you can call Kaiser and say, how do I find out when my turn is coming? Same thing if you go to one of the John Muir clinics or the CCRMC clinics. Be in touch with your healthcare provider in whatever way you usually get in touch with them to get the latest information on when your turn is coming.
So Anna, this is one that perhaps you can address from the perspective of CCRMC. How many high priority residents offered the vaccine are refusing doses? We're not necessarily in a position right now where people are refusing, but we are tracking sort of the percentage of our high priority people in phase 1A particularly are taking the vaccine. So there were some numbers that were shared last week from CCRMC that might give some good perspective on how many of those folks are taking them.
Yeah, thank you for the question. That's a great question. And we really we're seeing, again, we've been in the high priority group, we've been in the healthcare worker group. So we've actually, not a lot are refusing. So we're seeing about 85% or so are are really taking the vaccine. The other thing I think is really important, though, is that after a week or two, we're actually starting to see some of those people who wanted to sort of hold off come back and say, I would like to get vaccinated. So I think this will be a much more reliable number when we have sort of a month or so to look back, because many people who didn't, feel ready to be in the first week are starting to feel very ready as they've seen other, colleagues and peers get vaccinated. So I think that that's really important. And I wanted to answer, I saw there's a question in the chat, if it would be okay if I answer that one, Kim. This was from Matthew Boone on KCBS, who was asking that what's preventing us, if our target is sort of 7,000 a day, what's preventing us from doing that now versus waiting for a later phase? And I think it's a great question, and we are working towards that now. That is what we're doing now. And I think that when the vaccines first came, as you know, we weren't getting that amount of vaccine initially, and it was a very narrow group of people that we were vaccinating, but we're absolutely sort of doubling, and we've been doubling kind of every week the amount of vaccines given in our county for the last few weeks. As we start to get up to those higher numbers, you may not see as fast of an exponential rise, but we are absolutely working towards that 7,000 a day right now. And I will sort of hand off to Dr. Savelli, who is overseeing that operation, if there are more questions about sort of how that looks. But it's a great question. Thank you. And we're not waiting. Thanks.
So we have a question from Catherine Ho at the San Francisco Chronicle regarding the Safeway that will begin offering shots at one location this week. Which location is that? And will that be only for phase 1A people at first, or phase 1B, or everyone? So I'll just start by saying we're not talking about specific locations for a couple of reasons. First, you need an appointment to get a vaccine. So it doesn't really behoove anybody for us to just arbitrarily talk about which location it is. Secondly, we don't want people just showing up for security reasons. So there will come a time where all the Safeways will come online, but right now we are notifying the individual people who are assigned to get vaccines at that Safeway location which one it is, and we will maintain that. But otherwise, Dr. Savelli, if you want to talk a little bit about who is being referred to Safeway for vaccinations.
Yeah, we're still referring people to Safeway from the phase 1A eligible population, so healthcare workers mostly healthcare workers, emergency responders. We are about to start taking interest forms from phase 1B folks sometime in the next 2 weeks. And as we sort of finish up that phase 1A, which is now mostly starting, some are getting first shots, some are getting second shots. But as we finish that up, we will start assigning some of those phase 1B patients to the individual Safeways and Rite Aids, to our county vaccination sites, to the CCRMC sites. So we'll be assigning them to our whole network of vaccination sites to receive their vaccine. So just to clarify or repeat what Kim was saying, this does not drop into your Safeway. This is still go through the process, and when your turn comes up as an eligible person, then we will send you an appointment. It may be at Safeway, at Rite Aid, or at one of the county sites.
Great, thank you. The next question has to do with the sort of 1,400 unassigned doses that we talked about, that was meant to just kind of give perspective on how quickly we were moving through these vaccines. So correct me if I'm wrong, Dr. Savelli, and maybe you can talk a little more in depth about this, but those 1,400 are now being funneled into that Safeway pipeline, right, as those resources come online.
Exactly, yeah, the state is getting more and more streamlined in their ordering process. So we used to order once a week and get deliveries. They're now switching to sort of a daily ordering process and allocations process. So it's becoming smoother. We have more vaccine coming in all the time and immediately getting distributed to one of the vaccination sites. So we can just get it into arms. Our goal is to not have vaccine sitting around in our freezer. Our goal is to have it all in arms as soon as it comes in.
So Anna, I wonder if I could get you to talk a little bit about sort of the way that we are moving back and forth between phases. So phase 1A is obviously our first priority, but as we know, the governor opened up more flexibility to move into phase 1B. And I think you came up with this great idea of sort of airline boarding and how this all works. And so I thought maybe I'd ask you to talk a little bit about how we're thinking about that process.
Yeah, thank you, Kim. Yeah, it's true. I do think it's the phases and moving through the tiers. Initially, we really were just, it was very clear we're just in 1A, and within the tiers within 1A. But as the vaccine is moving, as Dr. Savelli is describing, and I think there was a question in the chat around what happens to those 1,400 doses. We're sort of onboarding tiers simultaneously. So, we phase 1A, tier 1, sort of was clear the first week. By the second week or the third week, you're moving into tier 1 and 2 and tier 1, 2, and 3. And now, as you all know, late last week, the state did say, in order to sort of keep things moving, reduce any waste, you can start to look to tier 1, phase 1B, I'm sorry. So I guess the way I look at it, and I think a simplified way, is to think about kind of airplane boarding. So, group A, gets called to line up, and when they get, through a certain amount, and there's no fixed amount, because it depends on how much vaccine is coming in, how many people we have vaccinating, but, when we start to really feel like we're maxing out that, we can start to call and sort of line up people in the next phase. And that's what Dr. Savelli is talking about. Some people who are in phase 1B are now starting to get lined up, and so you'll be getting a ticket to register. And for those who have registered, we're going through those to see if it's time for you sort of to be in the queue now. And so I think to think about, when will phase 1A be done is a mistake in the thinking that way. Phase 1 will always be going on because there will be new people moving, coming on, new employees, that sort of thing. It's about expanding the phases. And so to some degree, they will be happening simultaneously, just the emphasis will start to move. And I don't know if that is helpful, but the way that I sort of look at it is sort of opening the door wider and wider as the weeks sort of go on. It really is about expanding the ability for people to sign up.
Great, thank you. So Dr. Savelli, maybe you can talk a little bit about second doses of vaccine and kind of how that rolls out and how that incorporates with our movement through the tiers.
Sure. Yeah, the vaccine, both the Pfizer and the Moderna vaccines are both 2-dose vaccines. There may be other vaccines that will get approved in the future that are 1-dose vaccines, but for now, both are 2-dose vaccines. And our goal is when we bring you in for that first dose, that we give you the appointment for that second dose. So, as you know, when we started with phase 1A, we saw that a lot of people were getting vaccinated. Then it sort of slowed down because a lot of them were coming in for the second dose, so we had less capacity for first doses. We are now building up our capacity. So we have, literally the capacity for thousands of first doses. That balance, as we do more of those, will slowly sort of shift. We'll have more second doses relative to first doses, but our goal is to continue to expand capacity, bring on more providers as that happens. So we'll keep adding capacity for first doses too. So it's always a balance. The state also allocates, the way the federal government and the state have done it is they've held back some of the second doses until now. There's talk with the Biden administration coming in of them shifting that approach after January 20th and releasing more doses all at once. And we're still expecting to see what the state of California will do with that. So we can predict how much vaccine supply is coming in.
So as we move through the phases, obviously it gets a little more complicated as the numbers of people in these different phases gets bigger, and our need to really communicate and get them into the process gets a little more complicated. So can you talk sort of in detail about the process for getting phase 1B vaccinated, and how we will be working in partnership with our other healthcare providers and kind of using that network?
Sure, that's a great question. We have, so we have our large partners, for example, Kaiser and Sutter. Those are large multi-county entities. They've both announced that they will start vaccinating phase 1B before the end of this month. And so they will be reaching out to their eligible patients and say, hey, you're over 75, or hey, you're an essential worker. It's your turn. This is how you sign up for an appointment. We're also working with John Muir to have a similar system. We're signing up more and more pharmacies so the people that come in through the county website and express interest will get assigned to either one of the county mass vaccination sites or to one of the eligible pharmacies. We're also hoping that as many of the sort of smaller mom and pop provider offices sign up to be vaccinators. That includes dentists now as well. They can sign up. So there's some requirements that their offices have to have, like they need to have a refrigerator with a temperature log on it, so we can make sure the vaccine stays fresh and stays in the desired range. But when they can do that and they sign up through the state website, which is getting a big revamp this week, we hope as many sign up as possible. And then they can request through, after they're signed up, they can request for us to allocate the vaccine. And our goal is to keep allocating it. We want to give it to whoever can put it into arms. So we want as wide a distribution network for this vaccine as possible.
So Dr. Savelli, maybe you can talk a little bit more specifically about what it means to be signed up, that process that they go through with the state, and why that's important.
Sure. They sign up through a state system called CalVax. They need to attest to the fact that they have refrigerators. They need to show that they understand who the eligible tiers are. They need to understand the fact that this vaccine cannot be wasted, that every single dose needs to be put in an arm. So towards the end of the day, if they open up a vial for their last patient of the day and the vial has 5 doses in it, they need to have a system and to make sure that 5 more people get vaccinated, then that doesn't get wasted. So they have a lot of things to attest to. They have to promise to stick with the state tier system. And then they need to work out the logistics with us to either come pick up the vaccine or receive it. So there's a lot of things they have to do. On the other hand, the state is making it a lot more streamlined and approving it a lot faster than they were. So I think we've probably had over 30 providers, large groups, physicians groups, and hospitals signed up. And I think we're expecting probably over 100 in the next couple of weeks to sign up. So again, we're trying to distribute this as far and wide as we can.
Great. Director Roth, I wonder if I could ask this question. The question is, what if someone in phase 1B doesn't have a healthcare provider or insurance, and how will we get a hold of them? But also maybe I could prompt you to talk a little bit about our Equitable Allocations Committee and the work that they're doing to make sure that we're really reaching out to across the community and making sure that this is rolling out the way that it's supposed to, and the way that is equitable and fair to everyone.
Yeah, thank you for the question. I think a couple of things, just to answer the question directly, if you don't have a provider and you don't know where you might be getting your vaccine and you are eligible, you can go onto our vaccine website and you can sign up to get a vaccine. And when you are eligible, once that's confirmed, then you would get contacted through us. The other thing, though, I think is that a major sort of consideration and task within this this work is really communication and outreach. And we do in fact the Vaccine Ethical and Equitable Allocation Committee does have a communications arm that's thinking about that, as well as the health department itself within our COVID response structure, have a team of people who are really thinking about how do we specifically communicate with historically marginalized communities, with at-risk populations. How do we reach people who are harder to reach? And we have brought in a variety of community partners to really be thinking about how to do that, as well as communication experts. So it really is an all hands on deck sort of thinking, and it's really a sort of 360 consideration around making sure it's not about just making the vaccines available and having that network, which is critical, but it's also about making sure that we really do this in an equitable way, and those who are at risk and those communities who are really bearing the burden here are really we have a deep connection to, so that we can make sure that that vaccine is widely available within those communities, as well as the community at large. So it really does require a lot of thinking. We have whole teams thinking about that. I hope that answered the question.
It did, and I'll just ask that right now online is how we're having those who are eligible in the healthcare field register, but we will be bringing a call-in center online where people can call in and register themselves. Also, part of the outreach that Anna was talking about really is about community outreach and making sure that trusted members of the community are reaching out to folks that live in their neighborhoods and making sure that they clearly understand, and assisting with that registration piece. And so we're in the very early stages of that very sort of complex outreach effort. Traditionally, and this goes to kind of the next question from Tony, right now we're communicating mostly through employers, because healthcare providers are the ones who are phase 1A, tier 1, 2, and 3. And so we're really reaching most of them through their employers. But as we move away from those groups and into the more general population, we really will be counting on healthcare providers to let their members know that it is their turn. And then also for these community leaders to really take that message out into the community for us and make sure that people have, whatever they need to be able to register for that service. So, Ori or Anna, anything that you want to add to that point?
I think that I would just stress that this is sort of not a one and done. So I think, we very much like testing. When we first stood up testing, if 6 months, 10 months ago, a long time ago, this is really going to be a scalable effort. So I would encourage people to come to our website frequently, because we put a lot of information on there. And again, I think Kim McCarl, our chief communications officer, our PIO, is working also with many of these groups to place that information on our website in ways that are really that are very user friendly. This is a lot of complicated technical information, but at the end of the day, our goal is for people to be able to just come on and register, say I'm interested, and then we can help you wayfind. And so we're moving ever closer to that sort of intuitive system, and we understand, like the testing, that's really where it has to get. So I would encourage people to check the website regularly. I also, again, I think Dr. Savelli said, and I would stress, your healthcare providers, we're working with them right now. So, there will be a lot of information, continuing to come out into the community. And then finally, we plan to come back and talk to you on a regular basis. So, whether it's through a formal press conference or Facebook Live or small videos, we understand. Again, I think I started saying this is the largest immunization effort undertaking that we've ever tried to undertake. We understand the scope and magnitude of this, and we are in this for the long haul until every person in Contra Costa County who wants a vaccine gets one, and we're able to answer all the questions people have about it, because it's that important, and it's a priority for us. So.
Ori, maybe you can talk a little bit about the reach of the 11 clinics that CCHS operates, and then also the concept of kind of pods, where we're going in, these kind of closed pods, where we're going into specific communities and vaccinating them, and the way that we envision that sort of happening with marginalized communities and the opportunity to sort of reach those 75 and older using those tactics as well.
Sure. Yeah, so the county clinics operated by CCRMC, I know that they're already started vaccinated in Martinez, and by the end of this week, they should be also doing vaccinations in Pittsburgh Health Center and West County Health Center. And I think within a few weeks, they'll be vaccinating at all 11 sites. As far as the concept of a pod is a point of dispensing. It's a discrete group of people that we can reach. For example, all residents and staff of a nursing home. So we have mobile vaccination teams that go out to these locations. Right now, because we're doing healthcare environments, it's mostly nursing homes, assisted living facilities, but we also have plans to go to some senior housing sites. Some employers, some large employers who are interested in partnering with us when it comes to phases 1B and 1C, we'll be reaching out to and accepting inReach from to set up a pod. If it's a large number of employees we can get to with a mobile team, we will do that. Sometimes it's that's more efficient. At other times, it's more efficient to have people come to our mass vaccination site. So it's all depends on the particular circumstance, how many coolers we have available, how much vaccine we have available that can go out. So there's a lot of discussions about that, but we really like the concept of pods. It helps us get a larger footprint out in the community.
So that's really all the questions that we've gotten. I'll make one last call for any other outstanding questions that there might be. And while we give that a minute, I think there are a couple of points that are worth reiterating. The first is that the vaccine does not do away with the need to really pay attention to those protective measures that we've been talking about since the beginning of this pandemic. The need to shelter at home, the need to wear a mask, to socially distance, all of those pieces are important, even if you've gotten the vaccine and even as the vaccine is rolling out. So I think it's incredibly important for us to just remember that we're not advising the letting up on any of those protective measures, even if you've had the opportunity to have the vaccine. So kind of one last question, how will you make sure the most marginalized communities will get the memo? Think about those people who do not have easy access to a computer or communication with large groups of help. So, I mean, I think that's the point about our community networks and our community engagement and outreach team that is working specifically with specific work groups to reach those. So we have work groups that are targeting the African-American population, the Latinx population, older adults, youth, American Pacific Islanders. We have a very well-developed infrastructure that we are putting these messages out specifically through those work groups and through our community organizations. We are very grateful for the partnerships that we have with organizations like Choice in Aging and the United Latino Voices, who have been at our side and so helpful in making sure that we understand, you know, what the communication needs to be and what the communication tactics need to be. And you know, we have used, as is true across the board, we have used the testing process to really develop those networks and those channels to make sure that we can easily reach them. For instance, we did the testing event in early December in West County to make sure, you know, that we were reaching those communities with kind of on-site testing. And so when we talk about pods and we talk about outreach, we are very grateful to have that infrastructure in place and to be able to tap into that. It is a constant effort and a constant concern for us that we are reaching those communities and that we are serving them the way that we need to be. We're very conscious of the marginalization of those communities and paying very close attention to making sure that they are served in the way that they need to be. So I hope that sort of answers the question. And then one last question, is the county distributing both the Pfizer and Moderna vaccine? So, or maybe if you can take that one.
Yes, we are. We get some of both from the state every week, and we are distributing all of the both of those. And we expect that other vaccines get approved in the future, that we will distribute those as well.
Okay, I'm gonna unmute. It looks like Jody Hernandez from NBC has a question, so I'm gonna unmute her. Did she go away? Kayla, do you see Jody? Did she drop off? Okay.
Can you guys hear me?
Excellent. Yes, thank you, Jody. Go ahead.
Hi there. Sorry, I've been trying to get my question through the chat and the message, but I'm not having success. So I just wanted to just clarify what the delay has been in getting some of these pharmacies online. Yeah, I know I heard you guys mention that Safeway was coming on board this week. But what is the timeline? When can we expect more of these pharmacies to start helping out? And also the dentists, what have they started yet? When will that begin? I talked to a dentist last week. I think it was the president of the Dental Association, who seemed to think that they wouldn't be giving vaccinations in the offices. So what is that going to look like? She thought it was more like the dentists were going to go out to these mass vaccination sites.
I can take that. So the pharmacies first. Yeah, Safeway and Rite Aid are both starting this week. A lot of it is beyond staffing, setting up refrigeration, setting up the ordering system, signing up in the state CalVax database to be an official site. Walgreens and CVS are also on the way. They have a federal partnership to go into the nursing homes and assisted living facilities and vaccinate there, that they've been working hard on since the last week of December. So there's a phasing to that partnership, and I think they're going to be doing some vaccination in their brick and mortars soon, but they're still doing that piece of it. As far as the dentists are concerned, we've already reassigned some of the dentists that work for the county to be participating in the mass vaccination sites. Other private dentists in the community, we really do hope that they do sign up with CalVax. If they're able to vaccinate in their office, we would love to see that happen. Like I said, we want as many people vaccinating as possible. So the state only authorized dentists, I think, to become vaccinators about a week ago. So I think a lot of them are, the word is still getting out there, but we're really hoping that as many as possible sign up, especially if they feel like they have the refrigeration capacity and they can move the vaccine. Great,
thank you. So Tehana, I'm going to go ahead and unmute you. I'm not sure if you've gotten your questions completely answered, so let me just make sure. You can go ahead and unmute yourself. Go ahead.
Yes, we just want to make sure we're clear on the actual process of how it's going to happen. I know you guys are saying, go to Kaiser, go to Sutter, or Kaiser and Sutter will let people know. But we want to be extremely clear because there are a lot of people calling us and asking, hey, if I'm next, so what do I do? What do I do? That's why we've been also knocking you guys' doors, trying to figure it out. So can you just help us just kind of clarify as much as silly as it sounds, but as much clarification we can get with the process, so we're everybody's on the same boat. It'd be really helpful.
Ori, do you want to walk through that one more time and then we'll fill in any blanks?
Sure. I mean, I think the main thing I will say is, as phase 1B tier 1 rolls out, is that there will be more and more eligible populations, and on our website, coronavirus.cchealth.org, you will be able to find instructions on how to sign up. So as soon as we have the details from Kaiser about which 800 number to call to get yourself to your vaccine appointment, we will put it up there. Same with Sutter, same with all of our partners. And then there will also be a link, if you are in the eligible population, for you to sign up through the county sites as well, the mass vaccination sites. So if you're an essential worker, if you're over 75, There's a form that you'll be able to click on, fill out your information, and that gets submitted to the county. And then when your turn comes up, the county will send you an email back, and you'll be able to register for your appointment that way. We also, starting next week, will have a call center, so people will be able to call and make vaccine appointments if they're in the eligible population that way. So stay tuned, check the county website. It's really changing very frequently, multiple times a day. And as people become eligible, as the capacity opens up, we will open up more and more options.
And I will say this about communications. It's a process. We don't do one thing and then call it done. We continue. I mean, to Anna's point about the sort of airline boarding process, we go back to those communities time and time again and try every different tactic and every different channel that we can to make sure that that information gets shared. So it is an ongoing process that we're dedicated to getting the word out in any way that we can. So that is all the questions that we have. So I want to thank Dr. Savelli and Director Roth for joining us today. Hopefully, there are still lots of questions to be answered, and this is a process that is very much rolling out. And we are really committed to being as transparent and forthcoming with information as we can be. We will be, I think, standing up some dashboards with vaccine information on our website this week. We have to have information, we have to have data in order to populate the dashboard. So that's always a little bit of a lagging piece that happens, but we're starting to accumulate that. We will continue to keep you and our communities updated on kind of how our capacity grows. And as we move through the phases and the tiers, we share the community's sense of urgency around this and are committed to putting every resource we have available to getting these vaccines into people as quickly as we possibly can. So thank you for being with us today, and we will do this again in the not too distant future. So thank you all.